online. And then my name is Rolanda LaValle, and I'm a practice consultant at CRNNL, and I will start the presentation today, and then I will be joined by Michelle Carpenter, who will pick up on the second part of the presentation. So as Peggy mentioned, our presentation today is on the standards of practice for registered nurses and nurse practitioners, and it's the 2019 version. So during our presentation today, we will describe the process of updating.
The conference is now in silent mode.
We will highlight some of the changes in the new standards as compared to the 2013 standards of practice. And we will discuss or review application of the standards in practice. So we will begin the presentation by providing a brief review of what exactly are standards of practice. And standards of practice are broad, authoritative, principle-based statements that articulate conduct or performance expected of registered nurses and nurse practitioners. Standards of practice describe the minimal level of expectation, minimal level of performance, expected against which actual performance can be measured, and as a legal reference for reasonable and prudent practice. All RNs, nurse practitioners, and interim license holders are responsible to understand and apply the standards to their practice. And standards of practice also describe the safe, competent, compassionate, and ethical expectations across all practice settings and domains. So in October of 2019, the standards of practice for registered nurses and nurse practitioners was approved by Council. And then towards the end of October and into early November, you all received a copy of the 2019 standards of practice in your mailbox. So the new standards were developed as a result of a review of the standards of practice for registered nurses, that's a 2013 version, and the standards for nurse practitioner practice in Newfoundland and Labrador, also the 2013 version, to ensure the standards were current, that they were clear, and that they incorporated all regulatory requirements. So to provide you with a timeline surrounding the development of these new standards, in April 2018, a multi-jurisdictional review of the standards of practice for registered nurses was initiated by staff of the College of Registered Nurses of Newfoundland and Labrador, the New Brunswick Association of Registered Nurses, the Registered Nurses Association of Northwest Territories and Nunavut, and Yukon Registered Nurses Association. And then at the same time, there was also a review of the standards for nurse practitioners was occurring at that time as well. So following the review of both standards of practice, in 2019, the standards document was created to encompass the standards of practice for both RNs and NPs, just highlighting that the previous versions, which were 2013, were two independent documents, but this 2019 version is a document which combines both registered nurse and nurse practitioner standards. So as a result of this revision process, the following 7 standards were created and approved as the new standards of practice for registered nurses and nurse practitioners. And so as you will see on this slide, the first 4 standards apply to both RNs and NPs, and standard 5, 6, and 7 apply to just NPs. So the new standards of practice, Standard 1 is responsibility and accountability. Standard 2 is knowledge-based practice. Standard 3, client-centered practice. Standard 4, professional relationships and leadership. And then for the nurse practitioners, Standard 5 is collaboration, consultation, and referral. Standard 6, assessment and diagnosis. And Standard 7 is client care management. And as you can see on this slide, we also have a new visual which shows the relationship and the overlap between the registered nurse and nurse practitioner standards. And it is, as you can see as well, color-coded, but on the inner circle, the first 4 standards are for RNs and NPs, and then the final 3 are for nurse practitioners. So it is not our intent of our presentation today to highlight all the changes that were made to the standards. However, we will highlight indicators and standards that have more significant changes. So for example, Standard 2, which is knowledge-based practice, and it was knowledge-based practice in our 2013 version as well. So there were some minor changes made to this standard, and these changes, again, were made to ensure that they were current, and we also made the indicators a little more specific than they were in the 2013 version. So in 2013, under Standard 2, we had an indicator which stated the registered nurse contributes to and supports the analysis, development, implementation, and evaluation of best practice. However, in the 2019 version, this indicator is now indicator 2.9, and this indicator has been revised to reflect the current literature and is more specific and inclusive of all domains of nursing. So the new indicator states that contributes to the advancement of evidence-informed practice through initiation and/or participation in research and scholarly activities. So we have included a couple of case studies throughout this presentation today to further elaborate and explain various indicators. So this case study is surrounding indicator 2.9, which again is under knowledge-based practice. So in this case study, it states, Jenny is a clinical educator on a med-surg unit and was recently introduced to a new wound care product that is being researched and trialed with positive outcomes for a particular wound. Jenny had a conversation with the wound care specialist and her manager regarding this product and the benefit of participating in its research. After many conversations within the organization, it was decided to participate in the research by using this new product over the next 8 weeks. As a part of the pilot, the NP will also be ordering this new wound care product. And in addition, Jenny and the nurse practitioner has agreed to present on their experience with the new wound care product at the next research symposium. So the question is, how are the clinical educator and the RNs and the nurse practitioner meeting indicator 2.9? So like I said, in this case study, Jenny, the unit staff, the RNs on the unit, and the nurse practitioner are participating in the research because, like I said, Jenny, has brought this information forward regarding this new product, and which has resulted in the unit participating in this research. So as a result, everybody that's involved are meeting this indicator by merely just being involved in this research. And then Jenny and the nurse practitioner who will present on their experience at the research symposium, are involved, are displaying, being involved in scholarly activities by deciding to do that presentation. So next is Standard 3, which is client-centered practice. And in the 2013 version, Standard 3 was client-centered practice, so that did not change. However, we have made changes to the indicators under Standard 3, which has impacted indicators under Standard 4. And I'm not going to get into Standard 4 right at this moment because I will discuss that shortly. But Standard 3, which is client-centered care, in our 2013 version, had a number of indicators that actually referred to leadership. And there were some indicators in Standard 4 that actually focused on client-centered care. So what we did was we moved some of the indicators from Standard 4 underneath Standard 3, and we moved some from Standard 3 under Standard 4. So Standard 3 indicators were therefore, like I say, realigned to focus more specifically on client-centered care. So there was an indicator under Standard 4, which was protect clients' privacy and confidentiality. So that indicator is now under Standard 3, and its indicator is 3.5. And it states that the registered nurse practitioner upholds and protects clients' privacy and confidentiality in all forms of communication, including but not limited to e-records, verbal, written, and social media. So the following is a case study to further elaborate and explain indicator 3.5, which is under Standard 3, client-centered practice. And it states, Karen, an RN, works in long-term care. She has become close to Esther, a client who has recently celebrated her 95th birthday. During the celebration, Karen asked Esther's daughter if she could take a picture with her cell phone, and Esther's daughter said that would be fine. Later that day, Karen posted a picture to her Facebook with a caption stating, "So happy I work with special people like this." And Karen's profile identifies her as a registered nurse who works at Shady Lane Nursing Home. So what should have been considered in this scenario based upon Standard 3, specifically Standard 3.5? So Karen, in this scenario, she breached indicator 3.5 by using her personal cell phone to photograph a client and then posting the client's picture on her Facebook account, which also identifies where she works, which is Shady Lane Nursing Home. And in this case study, Karen should have considered her standards of practice, like I said, specifically 3.5, which says we uphold and protect client privacy and confidentiality in all forms of communication, including but not limited to e-records, verbal, written, and social media. So she should have considered her standards of practice and also her employer policies surrounding privacy and confidentiality. We also have a new indicator under Standard 3, Client-Centered Care, which is 3.9. And this new indicator states that registered nurses and nurse practitioners respects diversity and promotes cultural humility and a cultural safe environment for clients and members of the healthcare team. So again, this is a case study to further elaborate and explain this new indicator, 3.9. So it's Lisa, as a novice nurse and a member of an indigenous community, receives her patient assignment for her shift. During report, Lisa hears about an Indigenous client on the unit who is one day post-op from a lower leg amputation. The night RN's report indicated the client is lazy, non-compliant, and deserves this outcome. Lisa immediately feels disrespected and wishes she could stop the report and share her disappointment with her colleagues seated around the table. As the day progresses, Lisa cannot get this experience out of her mind and feels it is impacting the nursing care she is able to provide. She is unsure how her colleagues feel about what happened and does not feel safe asking them or sharing her thoughts. Lisa fears speaking out as she is new to this unit and does not want to affect her career. So how can Lisa meet indicator 3.9? So Lisa is responsible as a registered nurse to adhere to the Code of Ethics for registered nurses and therefore to advocate for her client and herself. So therefore it is important that Lisa does address this situation. If Lisa isn't comfortable, which we've identified in speaking up, she could consult with her nurse manager or supervisor for guidance. Lisa could use the following nursing values from the Code of Ethics to speak with the registered nurse in question and other colleagues on her unit. And one of those values is providing safe, compassionate, competent, and ethical care. And under this value, it states nurses question, intervene, report, and address unsafe, non-compassionate, unethical, or incompetent practice or conditions that interfere with their ability to provide safe, competent, compassionate, and ethical care, and they support those who do the same. There is another value known as honoring dignity, and it states that nurses intervene and report when necessary when others fail to respect the dignity of a person they are caring for or a colleague, including students, recognizing that to be silent and passive is to condone the behavior. They need to speak up, facilitate conversation, and adjudicate disputes as appropriate or as required. And the final value is promoting justice. But under promoting justice, it states that nurses respect the special history and interest of Indigenous peoples as articulated in the Truth and Reconciliation Commission of Canada's call to action. So as I indicated earlier, Lisa is responsible to adhere to the Code of Ethics. And that is actually an indicator under Standard 1, which is responsibility and accountability. It's indicator 1.3. So it is important for Lisa to address this situation, regardless if she's new to the unit or not. And then our final standard is professional relationships and leadership. And as I mentioned earlier, we did make changes to this standard. The standard 4 in the 2013 version was called public trust. And so now it's called professional relationships and leadership. A new indicator under standard 4, which is indicator 4.1, it states that registered nurses and nurse practitioners provide nursing leadership in informal and formal roles. And the following is a case study to further elaborate and explain indicator 4.1. And it states that Randy has been a dedicated CCU RN for 20 years. And over the years, Randy has provided nursing care to many clients who have experienced a myocardial infarction. Randy has been vocal about the lack of access to health promotion programs in his community, which has led him to integrate comprehensive teaching related to healthy lifestyle choices. Due to his leadership in this area, his nurse manager has invited him to represent their unit as part of a cardiac wellness pilot project. So the question is, how can Randy meet indicator 4.1? which provides nursing leadership in informal and formal roles. So Randy can use his expertise to inform the pilot project team about the need of upstream investment in preventing cardiovascular disease. He can also advocate for community health promotion programs. He can advocate and emphasize the need to collaborate across all sectors and the importance of involving the public in this project as well. And being a leader, he can also inform his colleagues of evidence-informed knowledge of population health, of the determinants of health and their interactions, and how to base decisions on evidence. So Randy, in his role, can act as both a formal and an informal leader, in this case study. Okay. There's also a new indicator. It's indicator 4.7. And this states that registered nurses and nurse practitioners practices both independently and in collaboration with members of the healthcare team while understanding and respecting other team members' scope of practice and contributions in the delivery of safe, competent, compassionate, and ethical care. And this is our final case study to, again, further elaborate and explain indicator 4.7, which is a new indicator under Standard 4. And it is Rachel is a nurse practitioner and Patsy a registered nurse, worked in a busy primary care clinic. Their manager, Jolie, also a registered nurse, has decided to add another staff person to address workload issues. After completing a job analysis, she decided a licensed practical nurse would be the best fit. So the question is, how will Rachel and Patsy ensure they meet indicator 4.7 when the licensed practical nurse is hired? And how could Jolie, the manager, meet this indicator as well? So all staff members involved can meet this indicator by respecting and seeking to understand the licensed practical nurse's scope of practice. For example, they can call the regulatory body for licensed practical nurses and inquire regarding the scope of practice. They can seek documents on their work site. They can talk with other say stakeholders or people they've been involved with who have licensed practical nurses working in their areas. They can consult with if they have a professional practice or professional practice in other areas. They can facilitate a staff meeting to discuss how they can work collaboratively as a team that Jolie can coordinate and oversee. They can create and maintain a safe and respectful work environment for all. And Jolie, as the manager, should ensure that everyone's scope of practice is clearly outlined, that policies are updated, and that huddles occur to check in on teamwork and to clarify any questions that may arise related to collaborative practice.
Rolanda, can I just add, staff could also speak to the licensed practical nurse herself to determine what that individual scope of practice is for that individual licensed practical nurse as well.
Thank you. Okay, so I will now pass the presentation over to Michelle Carpenter, who will further discuss the nurse practitioner standards. So as you can see in the diagram, it's the standards 5, 6, and 7.
Thanks, Rolanda. So just to introduce myself, I'm Michelle Carpenter. I'm a nursing consultant for policy and practice with the College of Registered Nurses of Newfoundland and Labrador. And most of my work, I guess, is in the nurse practitioner realm, and I'm the lead for nurse practitioner practice. And as Rolanda has elaborated on, is that we have 3 standards that address the advanced competencies of the nurse practitioner. And these 3 standards, originally in the old version of 2013, there were 4 standards, and they have been incorporated and I guess condensed into 3 standards, and the names have changed. So you'll see as we go through that the names of those standards have changed from the previous version. It's also, when you review the standards document, you'll also note from the previous version that much of the scope of practice information that was in the nurse practitioner standards of practice has been removed. And what we plan to do is that information on the scope of practice information that was in the MP standards will be incorporated into a new updated version of our scope of practice document. Now, the information that is in our current scope of practice document certainly covers, the scope of what you're educated and authorized and being able to manage the outcomes. It's still the same as what was in the nurse practitioner version, but that will be all incorporated into a single document that includes RN's and MP's scope of practice. Also, over the years and through practice calls, the RN regulations refer to forms of energy and also in our MP standards document. So in our new version, we have clarified what forms of energy means, and forms of energy include but are not limited to tests such as a chest x-ray, an MRI, a CT scan, a PET scan, an ultrasound. So there was some confusion of what was meant by forms of energy, but that has been clarified on page 9 in the document. Also, you'll note on page 9 of the document that previously we referred to streams of practice for nurse practitioner practice. But to align our standards of practice to what's outlined in our RN regulations, you'll now see that nurse practitioners are licensed under categories of practice rather than streams of practice. So the categories are still the same, just that, it's called a category rather than a stream, but MPs are still licensed in adult, pediatric, and family all ages. So from now on, when you have a conversation with us, or anyone within the college, you will hear a category of nurse practitioner practice rather than stream. So what's new in the MP standards? So starting with Standard 5, as I had previously stated, it's now called, instead of interprofessional practice, it's now called collaboration, consultation, and referral. And interprofessional practice has been expanded to include the nurse practitioner's responsibility to collaborate, to consult, and refer. And it encompasses more than just professional practice. Interprofessional practice is just one element. As you know, MPs work within interprofessional teams, so it is within their scope to also collaborate, consult, and refer. I guess the consensus was that we would expand so that it encompasses all of those elements within their scope of practice. I guess to address that, the work environments are expanding with nurse practitioners, and there are more MPs that are working in primary health care clinics, physician clinics, in self-employment, and so there was a need to reflect current practice settings and work environments. So you'll see that there were some indicators that were included in this version, indicators 5.8 and 5.9, to introduce to reflect the expanding work environments. And as you can see on the slide, we have standard 5.7, ensures closure of a practice or an extended period of leave will not interrupt continuity of care for clients. So an MP who will be closing their practice or away for extended period of leave will need to ensure that there is a process put in place to ensure that there's no interruption in continuity of care. Also, 5.8, and that it reads, discontinues the nurse practitioner therapeutic relationship only when they have reasonable grounds to end the relationship, have made a reasonable attempt to resolve the issue, have provided adequate notice to the client, and facilitates continuity of care and the transfer of client records. So as you can see, these two indicators were added to reflect the changing work environment. So what's new under Standard 6? Well, again, the title has changed. It is now Assessment and Diagnosis. And new indicators under Standard 6 provide greater detail on the expectations and elements of assessment, diagnosis, and follow-up. The wording has changed to reflect, the greater detail. So you will see some changes in those indicators. One example is 6.1. Performs now an assessment appropriate to the client's situation. Previously, it was performs a comprehensive assessment. Now it is up to the MP to determine what assessment is appropriate to the client's situation or presentation. So, for example, it will be up to the nurse practitioner to determine when a client presents to them what is an appropriate assessment for the condition or illness that they're presenting with. Another change, and we've had a lot of questions from nurse practitioners over the years. Previously, there were two indicators regarding ordering diagnostic tests, laboratory tests, and other tests. Previously, if you were an adult or pediatric licensed nurse practitioner, you could do it independently. And if you were a family all ages, it required a consultation with your consulting physician and depended upon the employer's policies. And now that indicator, two indicators have been combined to read orders diagnostic, laboratory, and other tests when indicated. So it is certainly in the scope of practice of all categories of practice of nurse practitioners to order these tests. It will be up to the nurse practitioner to determine if there's any limits or restrictions, particularly employer policy that prevents you from ordering it. But it is within the curriculum of their nurse practitioner program, and so it is within their scope of practice to be able to order those tests. Standard 7. Again, this standard name has changed to now be called Client Care Management. It was Therapeutic Management previously, but Therapeutic Management was not all-encompassing of what was in the scope of practice of a nurse practitioner when it relates to therapeutic interventions. And also, as I said, we had 4 standards previously, and now we have 3. Standard 8, that was previously procedures and interventions and procedures, and clinical procedures, that has been incorporated now into the client care management. So those invasive, non-invasive procedures and interventions has now been incorporated into Standard 7. In addition, Standard 7.1 has been added, obtains and documents informed consent. Nurse practitioners are autonomous practitioners, so they require an informed consent, so that was put in to reflect current practice environments. 7.8 participates in mandatory drug intervention monitoring and reporting programs. So as you know, there has been some changes in legislation. We have the Prescription Monitoring Program, and which falls under the Prescription Monitoring Act, that requires a nurse practitioner to access the current medication profile of a client through the pharmacy network, their CRNNL viewer, through the Newfoundland Center of Health Information. So through that pharmacy network, they have to have access and be able to go in and check that profile before they write a prescription for an opiate or tramadol. Another example is the reporting of adverse drug reactions, and there is required a new legislation that requires nurse practitioners to report an adverse drug reaction through Vigilance Canada. So there has been some changes in legislation, some requirements that are mandatory for nurse practitioners, and so you'll see that new indicator to address these pieces of legislation. Also, as we say in Standard 2, we have to have knowledge-based practice and evidence-informed practice. So one of those things as a best practice is an indicator that has been added to the Standard 7 is uses drug information systems like the current medication profile when prescribing medications or the such. So it's best practice to check the current medication profile before writing a prescription. 7.10 and 7.11 addresses the treatment of self, family members, and others close to them. I'm not going to read them out because they're quite lengthy, but if you are contemplating providing treatment to yourself, a family member, or others close to them, then nurse practitioners should be very clear on what the standards say regarding these circumstances. And in 7.10, we have it broke down to address urgent and emergent care, and then 7.11 is to address non-urgent situations. And we also have provided some definitions in the glossary regarding what is others close to them or a personal relationship. So there is clarification there. Also to, to address the opiate crisis, and we have also, as a nursing regulator, had committed to address the opiate use disorder that has been occurring in Canada, and all nursing regulators were asked to, in the next version of their standards, to address controlled drugs and substances competencies. So you'll see there's an extensive number of indicators that have been added that addresses the nurse practitioner's controlled drugs and substances prescriptive authority. And they range from 7.12 to 7.17. And I'd like to draw your attention to one in particular, and that is 7.16. So nurse practitioners are expected to engage in continuous learning and professional development opportunities to maintain competence in prescribing controlled drugs and substances. So there's an expectation that nurse practitioners engage in continuing education for prescribing controlled drugs and substances. So now we're going to look at how do we apply the standards of practice. So based upon the different domains that RNs and NPs practice in, we're going to give some examples of how RNs and NPs can apply the standards of practice based on their individual practice setting. So how can I apply the standards of practice if I'm an RN in direct care? Well, an RN or an NP can take action when a policy or practice is no longer persistent with best practice, best evidence. So they can bring it to the attention of their manager or their clinical educator to advocate for an update of a policy based on best practice. They apply the standards of practice when a nurse practitioner or NP self-assesses their knowledge, skills, abilities, and judgment to provide safe and competent care. They self-reflect and say, oh, I need some additional education on this new pump that we're incorporating into practice. RNs and NPs apply the standards when they ensure client relationships are outcome-focused and centered on their needs. It also is applied when they communicate with clients, families, and team members effectively and respectfully. In addition, when they support colleagues, clients, and students by sharing nursing knowledge and expertise by acting as an effective role model, resource, preceptor, or mentor. So when the clinical educator or their manager asks you to act as a preceptor for a new staff member or a nursing student, then you're certainly adhering to your standards when you assume that role. RNs in direct care apply the standards when they understand and respect the scopes of practice and contributions of all team members. So it's really important that you know the scope of practice of the individuals that you're working with and respect the contributions that they make to the plan of care. RNs and NPs, when they take action to resolve professional practice issues, they're applying the standards of practice. And we have a toolkit for resolving professional practice issues that can help the RN or NP to apply the standards and addressing and taking action in resolving professional practice issues. Also, when RNs and NPs ensure that the use of social media does not violate confidentiality, they're meeting and applying the standards of practice. So how do RNs and administration apply the standards of practice? And for a lot of I guess comments that we've had is that people find, or RNs and NPs in different domains find it hard to apply the standards. So that's why we wanted to break it down into different domains and give you some examples. So if you're a manager, you're a director in administration, then you can apply the standards by supporting RNs and other healthcare professionals in the provision of care. You can do this also by establishing and maintaining communication to support quality nursing services and research. And like the example that Rolanda gave in one of our case studies, the manager was supportive of bringing in this new wound care product and evaluating it, and then supporting the dissemination of the results of that pilot project. Also, when the nurse manager or the administrator makes administrative decisions about nursing service delivery. So you're applying the standards in that circumstance. When the RN and NP administration plans, implements, and evaluates workplace strategies to address organizational problems and strengths. So if you're engaging in continuous quality improvement processes, then you're applying the standards. When the RN and NP and administration establishes and maintains documentation systems to manage clinical and other relevant information. When they create an environment in which collaboration, professional growth, and mutual respect can flourish. And when they participate in the identification and resolution of professional practice issues, conflicts, and ethical dilemmas. This is how administration can apply the standards. So what about RNs in the domain of education, whether you're a clinical educator, you're a nursing educator, in that domain of education? Well, those RNs and NPs, it can apply the standards when they focus on educating nurses and nursing students. When they develop nursing education programs, courses, and in-services. When they integrate evidence-based theory and best practices into educational activities or policies. What about those in research? RNs and NPs that participate in research, how can they apply the standards? Well, some examples are when they conduct or participate in relevant research to support knowledge development for nurses in practice. When they analyze and interpret research findings and write appropriate reports and articles for publication. When they share practice implications and policy relevance of the research in a meaningful way with nurses and others. When they promote and contribute to environments that encourage the application of research findings to practice. What about those in policy? And I'll give our example of ourselves as nursing consultants, or those in government positions. Those are making policies for the nursing profession. Well, we can apply, or those RNs and NPs can apply the standards by focusing on integrating research into policy to facilitate evidence-informed practice. when those RNs and MPs in policy plan, implement, and evaluate policy to address systemic healthcare needs and shape larger public policy outcomes. When they promote and initiate measures that encourage innovation and input into changes within the healthcare system to optimize client care. So those were just a few examples of how RNs, MPs in the different domains can apply the standards of practice. And if at any time that RNs and MPs have questions of how to meet their standards, adhere to their standards, or even what does an indicator or a standard mean, they certainly can give us a call, either three of us, Rolanda, Peggy, and myself, Michelle. Certainly give us a call, and we have the number there for the college. And you can go out under our website, under Contact Us, and our individual numbers are there. But if there's, at any time, if you have any questions regarding the standards of practice for registered nurses and nurse practitioners, you certainly give one of us a call. I am